All right, I'm going to go ahead and call to order this meeting of the Assembly's Committee on Housing and Homelessness. Let's go ahead and do a roll call, please.
Skill sets are.
1 second. Alrighty, Miss Allard, Mr. Constant, Mr. Dunbar,
Here.
Miss Kennedy, Miss LaFrance,
Here.
Mr. Perez Verdilla, Mr. Peterson,
Present.
Miss Quinn Davidson, Mr. Rivera,
Present.
Mr. Weddleton. Alrighty.
Thank you. All right, so going through our agenda, next we have initial audience participation. We didn't have anyone signed up, so we will do our best to save some time during final audience participation. Then next we have our business items. So we have 4 items for discussion today. We have a discussion on winter abatement, update on mass care data cleanup, ACEH monthly update, and then an overview of housing resources current and future. So starting with the first item on our agenda, I had hoped to have time, discussion on winter abatement. I had hoped to have time to prepare some follow-up questions based on our last committee meeting, including some questions which weren't answered during the February meeting, and send them to the administration in advance. Unfortunately, I just did not have time to put those questions in writing as the administration prefers. So rather than waste time today, I'm just going to send those questions in writing to the administration. And from my perspective, I'm going to take this item off our agenda for future meetings. Is there any objection to that from the members? All right, I'm not hearing anything. So I imagine that we're going to come back to this topic likely in May when we do a debrief of the winter plan. So we're not giving up on this topic. It's just I think it'll be more timely when we do that winter debrief. Okay, then moving on to the next item on our agenda, which is the update on the mass care data cleanup. So this is a regular item on our agenda, and thankfully, actually, I'm just going to pause a second. Just want to note for the record, we've been joined by Mr. Weddleton and Miss Kennedy. So this item is a regular item on our agenda, and thankfully I've gotten a little clarity on this topic. So I'm going to lay the foundation as I understand it, and then I will invite the Anchorage Coalition to End Homelessness to correct anything I misstate. So back when mass care first began, there were no data collection requirements, and at some point that changed and data collection was required. The contractor had some difficulty catching up with the new requirements. Thankfully, the Anchorage Health Department did bring in a contractor to assist with data cleanup, ICA. We are now close to 95% data complete at the Sullivan. So this agenda topic isn't necessarily dealing with the Sullivan specifically. This agenda topic is one about making sure that we keep data up to date at the Sullivan, and 2, ensure that we are getting data in for non-congregate mass care facilities that have not been entering data. So all of this is critical, and it's important why we continue to have this on our agenda, because our ability to have complete data has a direct impact on our ability to get FEMA reimbursement for mass care. Specifically, FEMA requires 5 data points for each client: 1, age; 2, disability status; 3, pets or service animals; 4, any additional services provided; and 5, length of stay at the mass care facility. So the specific issues, as I understand them, are as follows. 1, there is a lack of service animal data entered into HMIS. 2, there are gaps in data at the guest house. 3, no data has been entered since September for the sockeye, and 4, no data has been entered since September for Creekwood, although it appears this facility has been closed down as a mass care site. So I'd like to turn it over to ACEH now to correct any misstatements that I've made on that topic, and then I'll turn to the administration.
Hello, thank you. This is Taria Ware, the Systems Improvement Administrator at ACEH. You are correct, Assemblyman Felix Rivera, that is how we understand it. The only other thing that I would add, and it will be in our report, is that we are actively engaged with AHD to solve this problem. The director of the health department, Joe Gervais, has been really instrumental in getting all hands on deck to figure out those people to be identified to get this data inputted. So we're hoping to have a solution. We don't have a solution as of today. And when I say solution, a person identified today, but I do know it's on his radar. It is on the radar of Kelly Isham at AHD. And I am hopeful that when we come next month, there will be someone who is actively entering data at those sites. Is there another specific question I can answer for you?
No, that's great, Ms. Ware. Thank you for that. So I guess I'll turn it over to the administration. And I know, there's been some confusion about this specific topic when it's been on the agenda in prior months. So hopefully this provides some clarity. Are you able to respond to any of the issues? And it sounds like, just based on what Ms. Ware said, it sounds like there's actually some good progress being made. But if you wanted to add anything else, now would be the time.
Mr. Rivera, I'm not sure who from the administration you're specifically asking to speak, sir.
Whoever is approved to speak and would like to speak.
Well, this is Director Gervais. As she mentioned, we are actively resolving this. We have a plan in place. We have not only internally addressed it in the health department, we've partnered with intensive case managers and other folks to help us get that data compliant. This is one of the reasons we also have asked for a lot of this activity to come through the hub, so they're initially entered properly, and then we can add on, continue their stay as they go from the hub location, processing through the hub, whether that be as a resident of the Sullivan moving to a non-congregate site, or if they go directly to non-congregate. The guest house is a great example, as I heard you reference that. There's not only the normal response operation, we are accepting patients there discharged directly from medical facilities through our normal clinic. For instance, somebody that maybe had a really severe TB or pneumonia that then goes over there. They might not even be a shelter resident. They are just temporarily affected by the lack of ability to go somewhere to shelter safely. So I would kind of pause it right there. I would say that that one thing worth mentioning was, as you mentioned, there had been a lack of data early in the response, and 99+1 had been asked by the health department to really step up their game. And under Caesar and the hub crew, they really went the extra mile to make sure, as you noted, they're 95% compliant. And a lot of it is that some of the non-compliance isn't even intentional. It's that people slip in and out of the shelter and use beds that belong to someone else. And a lot of the time, it's really hard to even, I think that's just an amazing number, 95%, given the nature of the operations that we have in play. So I wasn't prepared to speak today, other than, this is something the health department is highly active in resolving, this known issue. We've come a long way in the last 30 days, and I'd probably pause right there.
Great. Thank you so much, Mr. Gervais, for that update. So I'll go ahead and pause and see if there are any folks who want to get in the queue, have questions on this topic before we move on. Okay, not hearing anyone else, then we'll look forward to continued updates as the work continues. We will move on then to our next agenda topic, which I believe is the ACEH monthly update. You have the floor. Is that you, Miss Ware, who's giving the update?
Sorry. Yes, I'm the technology. I was ready, but apparently my computer was not. So let us figure that out. Here we come. So thank you for having us here again this month to continue to report on the housing surge and shelter stabilization initiative, where we're focusing on individuals over the age of 25 with no children in their physical custody. This is our data for February. As a reminder that this number here on the top row, total number of adults over the age of 25 experiencing homelessness in need of housing and supports. And I only read it because I know some people cannot see the screen because of how they have joined. So just wanted to make sure everyone understood what we were reading. That number is 2,125. These are only folks touched by the system. That does not mean that they are actually staying at one of the sites. So this is if they have received some kind of services anywhere in our homeless prevention response system. If you go to our dashboard, you will notice that some of these numbers that were previously reported have changed slightly, and that is due to our data quality and data completeness process. And so those have been updated, which is great. I did not update them on the slide, but next month I plan to have updated numbers for you. I just wanted you to understand if you went to our dashboard on why you're seeing a difference, and always encouraging you to see the dashboard or go to the dashboard and look at the numbers for yourselves. As stated before last month, that when Street Outreach was doing their PIT or hit count, the Street Outreach numbers of those adults over 25 served would be higher for that month, and they were. So we're looking at 330 versus the 177 for January. So we are definitely out and about and looking to reach more individuals. And then our adults that have secured housing has also increased. Many of our bottlenecks and challenges do stay the same. One of the new ones is our top one, which is coordinating with AHD to ensure data quality and data completeness at all EOC sites. That will be reported to FEMA for reimbursements. It's something you've already alluded to previously. I will go more into depth in further slides. So, and these locations that we're going to talk about are really the sockeye and the guest house. As was stated by Director Joe DeRace, the 99+1 team has really taken the bull by its horns with data, and their data completeness at their sites is 95%. It's amazing. So we don't have any worries there. It is the other sites that we have no knowledge of who's been identified yet that has that data completeness and data quality question. We are still in consistent conversations as far as this second one, which identification of resources within AHD to be leveraged in support of the facilitated exit strategy. And that is happening during facilitation. So that these things are ongoing, and we are hopeful that everything is going to be fine, and we're working together, which is great. And this is more of the same. These are just continued as we see them. So as we're looking at our data, and I know if you've heard my reports before, really into the data, it really tells our community story. I think there's some misconception on what data quality is. So just wanted to give some information here that data quality has components of data timeliness, i.e. approximately within 5 days entered into the system at the site, and data completeness, which is 95% of all required data elements are entered. So why is data completeness important? It's important because unless the data is known and entered into HMIS, it is impossible to complete system evaluation and strategic planning to improve client services and end homelessness. In layman's terms, we cannot identify people if they're not in the system. We cannot prioritize them if they're not in the system. We cannot make equitable systems if we don't have anything to go off of. So by entering into HMIS, that really helps us on a system to look at everything and say, hey, we can help. And I like Johnny. We can help Johnny here, there, and this is the program, or this is how we move him through the system in a quick and efficient way. The other thing about data quality is that information guides homeless service policy and decision-making at the federal, state, and local levels. And maybe some of you know that, but I'm hoping that someone on the call didn't, and that was information that would really help them to understand, why do we choose HMIS? Why are some agencies doing 2 and 3 different systems of data entry, so we can ensure that this is happening, that that information is guiding those policies. Some of our providers don't have a coordinated service agreement with the EOC, so that was another reason why their data was not included in their HD FEMA reports. For example, Salvation Army Family Hotel stays in the very beginning at the guest house and other locations from March 22nd of 2020 to June 30th of 2021 will not show on the FEMA report because there was no coordinated service agreement. Mass care data gaps, and we know that there are gaps and have been already spoken about, but just listing them here, that the guest house has no client data entered because since it became a part of the EOC as a non-congregate shelter as of July 1st of 2021. There has been a staff member identified from Beans Cafe that is being trained on data entry. So that's how we are saying that seems to be mitigated at this time. The sockeye, according to us, our information today, does not have an identified AHD person to enter that data, and therefore there still is no data as of today entered from late September. Things that delay, telling our story are not requiring HMIS data entry with funding. We are seeing that on some levels, and really want to encourage those conversations of why is HMI data entry important to our overall system response. Providers not following the data quality standards, when it takes you longer than 5 days to enter that data, what happens when we are pulling reports or when a report is due, or even if that data lives on somebody's desk or lives in a different system. So that is something that delays telling our story. Providers not communicating changes in staff, programs, funding, beds, or rooms available. This impacts definitely not only ICA, but again, our story. Because if they don't know that the changes have been made, then they're not able to react in a timely manner. And then at some point we become in a crisis mode, and also doing data entry for months prior in some cases. Initial programs and new providers, this is a great time in the beginning to build that relationship with ICA, who is truly helping us along the way in our community. I was talking to someone previously today, and they were talking about other communities and how ICA, does just certain things. The folks that we work with here in Anchorage, ICA is doing an amazing job. Several meetings, sometimes a day, 10 or 15 emails a week, just to ensure that they are representing our story to the best of their ability. But they can't do that without that conversation from us. And if you don't have that conversation, that's how some of these data points don't get captured. For example, service animals. If that wasn't relayed to ICA that we needed to capture that data in HMIS, then there's no button to click to capture that data at all. We're looking at our FEMA report as I know it for these dates. These numbers are absolutely phenomenal as far as the work that our providers, our municipality, the assembly, has been able to provide for our neighbors, our community members. So 8,700 individuals were provided beds. The unduplicated number is 6,009 individuals unduplicated between the time period of March 21st, 2020 and February 28th of 2022. Why is there an unduplicated number? It is because some folks have actually went to multiple sites, and so that is why the 8,007 number is attached to those multiple sites versus the unduplicated number is simply Johnny, Joe, Susie, Mark, in that kind of order to break it down for you. The average age was 42. The average nights per individual was 50, but the total nights for everyone is 250,331. So we as a community have provided a warm place, a safe place to stay for that many individuals. We have cared for them, and that speaks volumes to me. I really wanted you guys to see those numbers. Also, referrals provided 6,400. Examples of that are basic needs, rapid rehousing, employment, housing expenses. Other services provided, 3,818. Some examples are case management, cell phones, books, food stamps, identification, housing related conversations or items. So this is the work that all of your hard work has culminated to. To continue our data conversation, I wanted to talk again about understanding the work that SALA has been doing, again, with our medical services on just the non-congregate sites, as it's a benefit to our overall homeless response system. And so, and it was lacking before COVID. So these are some data points. I like data. They can always speak to you about their own data. So I'm just going to give you kind of the layman's terms. When we're looking at this, they're on one side of this column here, you're getting 7-day data, which is from March 2nd of 2022 to March 9th of 2022. I'm sorry. Yeah, that's 7-day. But the 30-day data is where I really want to concentrate at for this conversation. And that's from February 7th of 2022 to March 9th of 2022. So there was 110 medical interactions. Medical interactions can be considered either urgent responses like a psychotic or a hallucinogenic episode, and or a medical response like blood pressure or medication. Medical requests coming directly from those that are clients were 87. Urgent medical responses, cuts, someone had a seizure, those things, 23. Transported by EMS, they're actually calling for transport, 13%. But here's a great number, which is 43% estimated reduction in EMS responses. So 43% of the time they were able to step in and solve something so that person wouldn't have to go to the hospital or, basically to the hospital. And then this number also, for this time period, 25 estimated lives saved. And I said, what does that mean? And they were like, well, this is what we call saved a life that was in risk of life or limb. So this is an overdose and gave someone Narcan, or identified sepsis where someone could have died or lost a limb or been hospitalized without their intervention. Bottom line, that these are the people in our community that would have had to seek help in our emergency rooms, but because of SALA, were able to be helped right where they were at their non-congregate site. This doesn't also include what the intake that they do for every single person, which for an EMT takes 3 hours, or a paramedic an hour and a half, or APS reports or medication or anything else. This is just those numbers that they're currently tracking. Also, those that are experiencing homelessness often feel safe talking to our SALA remote medics and having difficult conversations that they might not have with someone that they just met. So definitely a great service. And then this is the 90-day trend. The solid line is going to give you the actual numbers, and then the dotted line is the average, which you can see is pretty steady there around the 50th mark. Another one I was super excited about was this heat map. Why is this heat map important? And it is important because it is showing you where the gaps are in our system as far as like when are people most likely when are they most asking for services or receiving services? And you're seeing here from about 6 a.m. till about 12 p.m., there's a lot of services provided and these give it to you by the hours in the day. So 6 a.m., the only thing that would probably be open for them to go to is the emergency room. And if you're looking for transportation, that would be your ambulance or your fire department. And so all of these things are mitigated with the assistance of SALA. And then also in the nighttime, you see a little pickup here between 5 and 7 p.m. So that is the DALA part that I thought you would be interested in. We would bring this slide to you every month about the changes, and as it is constantly changing, this was updated on February 22nd, and so we'll continue to bring that to you also. As we look at these possibilities, I feel like it's a good time to share some information just to make sure that we're all on the same page about the warming tent. AHD has been very responsive to ACH's response about health and safety concerns. Like I said, that partnership is insurmountable. And I actually went to the warming tent yesterday or day before yesterday. Very warm, constantly has propane running, and as said, I think at about 70 degrees. So just wanting to make sure if there were questions because that has come up before, that we have went there and our partners at the health department are ensuring that those that cannot access the inside of the building have a warm place to be outside. Mr. Rivera, do you want me to introduce David, or did you want me to entertain questions before this part?
Yeah, I'll go ahead and pause and see if there are any questions on that presentation. All right, I'm not seeing anything in the chat. I definitely appreciate all of that work, and it definitely seems like we are making progress, and I really appreciate everything the coalition is doing along with all of the partners. Okay, so we can go ahead and move on then to Mr. Canavan. Ms. Ware, are you going to introduce David?
Oh, yes. So the Coalition to End Homelessness has asked for HUD technical assistance. And so they have provided folks that will be boots on the ground in our community. And for today, we have a HUD representative named David Canavan, and I will let him kind of talk himself. If you can come on mute, sir.
Sure. Happy to be with you all here in Anchorage. This is my second visit during the COVID time. I was up here with the team from the CDC back in 2020. As Taria mentioned, here at the request of HUD's collaborative applicant, the Coalition to End Homelessness, to assist in delivering technical assistance around the closure of non-congregate shelter sites, in the sense that often it is the portfolio of HUD programs that assist individuals to access sustainable housing, which is the department's goal for everybody involved in homeless services throughout the country. So our team will be engaged probably for the next several months, working very closely with the HUD field office here in Anchorage and the recipients of the HUD formula grants at the municipality and state, as well as the recipients of the competitive grants among nonprofits. So looking forward to the opportunity to engage with everybody as we seek to end homelessness here in this community.
Great, thank you so much, Mr. Canavan, and welcome back to Anchorage. So I had a couple questions for you, Mr. Canavan, and then if any other members would like to get in the queue to ask questions, that's great. First question is, you are providing HUD technical assistance. Are you also helping out in any way, shape, or form with FEMA technical assistance?
The Federal Emergency Management Agency and the Office of Special Needs Assistance Programs at the headquarters level have a joint endeavor to assist in unwinding these operations that were stood up during COVID because of the nature of FEMA's emergency programs and HUD's steady state programs. With this first ever national emergency, we have seen an overlap in those programs, and it has required some additional guidance at the headquarters level to deconflict policies. For example, both statutory authorizing language require the funding to be the funding of last resort. And of course, both McKinney-Vento Act funds and Stafford Act funds cannot both be the funding of last resort. So at the headquarters level, the problems like that have been navigated for the last 20-ish months. So my focus, and I am funded by the Department of Housing and Urban Development, so that is of course my focus. I do assist the joint team at the headquarters level in navigating some of these issues.
Okay, great. Yeah, that's much appreciated. I know, we typically do monthly updates at the Budget and Finance Committee around FEMA reimbursement, and one of the things that we talk about pretty constantly is FEMA reimbursement for our mass care facilities, and there are a lot of concerns surrounding that. So any insights that you can bring to the table while you are up here, I think would be invaluable to our efforts. Okay, that's it from me. Are there any other questions or comments for Mr. Canavan? All right, I'm not seeing any. Thank you so much. Okay, so then I am going to go ahead and move us on. Just let me sneak peek at the agenda really quick. Okay, so next item on our agenda is the overview of housing resources, current and future. Last month, this committee heard from the Anchorage Coalition to End Homelessness, Cook Inlet Housing Authority, and the Homelessness Leadership Council with an overview of housing in Anchorage with some issues this committee should keep in mind. So I'm going to do a quick recap of that meeting. So first, Alaska ranks 15th in the nation in terms of the minimum wage required for someone to afford a 2-bedroom rental. And I think that wage was something like $23 an hour, working at 90 something odd hours a week, I believe is what I saw. So something frankly untenable. Add on to that a vacancy rate of 4.3%, and you can quickly see why ACEH has been warning us for months about the lack and difficulty of getting individuals moved into units. Currently, Anchorage has 2.05 permanent supportive housing beds per 1,000 residents and 0.42 rapid rehousing beds per 1,000 residents. In 2021, last year, most permit activity was in the single family category. There were only 51 units of multifamily housing built, and that was a Spenard project completed by CHA. AHFC manages affordable housing development funds through Dole, and at most, Anchorage should expect between 30 and 60 units built every year through this fund if, and that is if, an Anchorage project is greenlit by AHFC. So now to some of the challenges and suggestions that were raised at last month's meeting. With regard to one of the challenges was vacancy rates, and the suggestion was a diversification of housing types. Another challenge was lack of affordable units, and the suggestion was an Alaska Affordable Housing Trust. Another challenge was finding owners for capital projects such as hotel conversions. Folks familiar with the facilitated process know that that's something that we are in the middle of. The suggestion was a creation of a community land trust. A challenge was immediacy of the need. I think we're all familiar with that. And the suggestion was public-private partnerships. Two other challenges that folks raised were people struggling at the 6-month and the 24-month mark when they do get into housing. They don't have the services they need, either financial or social, to assist with their transitions out of homelessness. So it appears that at those two marks, 6-month mark and the 24-month mark, there just tends to be additional stressors, which can cause people to either be evicted or move out of their program. Speaking of evictions, evictions disproportionately affect previously unhoused residents. And then last challenge that was brought to us was a lack of funding to sustainably operate supportive housing. So for today's time, we're going to start by hearing from Bill Taylor with the Anchorage Home Builders Association, and then we're going to move on to a committee discussion. So Mr. Taylor, thank you for joining us again this month. So the floor is yours for whatever you'd like to add to the conversation.
Thank you, Mr. Chair. Can you hear me?
Yes, we can.
Okay, good. I am Bill Taylor. I'm representing the Home Builders Association today, and the chairman asked me to talk about what we can do in the way of policy revisions that may be able to relieve some of the pressures on homelessness. So I thought I'd toss out a couple of ideas, and this would be in the context of actually providing new shelter for homelessness. However, it wouldn't exclude remodeling per se. One of the things that I think could be very powerful is that the building official has the opportunity to not change the code, but interpret the code in such a way that policies could be created that would relieve some of the cost pressures that we're experiencing right now. And one of those ways manifested itself recently in a policy to stimulate the building of ADUs, which you can use that template and apply it to homelessness and maybe come out with some decent results. But there are code restrictions that prohibited a lot of the ADUs from being constructed in Anchorage. And one of the things that the building official did was what I call it, create a policy through the alternate means and methods opportunity within the building code to relieve some of the cost pressure points that are experienced when you are building. So I think if we're talking about providing new homes for the homeless in some way, shape, or form through apartments or individual single-family units, I think it would be critical for the building official to get involved and create policies that would allow these units to be built at with lower costs. And right now, the market conditions are such that it's pretty bananas, to put it in a technical term. And we do need some opportunity to channel our energy through the building official, because he does have the power within the code to relax. And that doesn't mean eliminate, it just means relax some of the stricter code standards without sacrificing life safety interests. So I think currently Adam Trombley is the building official at Development Services Department, and he's very familiar with how to use the alternate means and methods portion of the code to create policies that would allow us to build more affordable housing. So I think that's, Mr. Chairman, that's in a nutshell what I have to contribute today, and I'll open it up for any questions if anyone has any.
Great, thank you, Mr. Taylor, for those thoughts. Are there any questions for Mr. Taylor? If you have questions, I think now is the time, because I believe Mr. Taylor has to leave for a noon meeting. All right, I'm not seeing any thing in the chat right now. I appreciate your additions to this conversation. Definitely ADUs is a regular topic that the Community and Economic Development Committee talks about, and we have an ordinance before us. And then I understand that there is another ordinance that is in development regarding ADUs. So there should be work on there. And I appreciate your other suggestion regarding the building official. So thank you, Mr. Taylor.
Thank you, Mr. Chair.
All right, so not seeing anyone else, that brings us to the committee discussion. So basically what I was hoping to have today was a open committee discussion where I was hoping that we would be able to start with some talk about and concept of the goal. So what is the goal that we have when doing this work? What do we want to focus on? And then from there, talk about in specific focus areas, what kind of interest is in there in the committee to focus in on policy issues, funding issues, So I have a whole list of things that we can talk through. But let's start with the goal, though, and see if there are any thoughts from committee members with, the time that we have in this committee for the remainder of the year. What kind of goal do we want to accomplish? Thinking, of course, in the short term, but also in the long term, because some of these things aren't going to be a sort of a light switch kind of thing. What kind of goal do we want to accomplish when it comes to housing, specifically for housing as it relates to the homelessness response system? So any thoughts there? Oh, I also want to say, just as people are percolating and thinking, we do have subject matter experts on the line to answer any questions and to provide feedback. So we have, I believe we have pretty much everyone that was with us last month who are also on the line. So I think we have a representative from CHA here. We have a representative from ACEH, as well as a representative from the Homelessness Leadership Council. So I'm going to go ahead and turn to you, Ms. Kennedy.
Thank you, Mr. Chair. I think I had mentioned before that it would be interesting, and I think it would be valuable to have some kind of funding tracking system. And, we have so many different organizations and entities, obviously including the municipality, that are putting funding toward a variety of efforts in the whole homelessness world that I think it's really hard to know exactly how much money is out there and being invested, and and a little bit of who's doing what. But anyway, we certainly get reports from individual groups. We can certainly get funding information from the municipality itself. But I just think that from the standpoint of making the public aware of the kind of investment that is happening, and who all is really playing various parts in this effort, it would be wonderful if we had some way of doing some kind of, having some kind of clearinghouse, if you will, for where the funding is and how much it is. So I don't know exactly how we put all that together. But I think people would be really impressed if they knew how much effort was being made. And so I think it would be good if we could find a way to track all of that together and have it basically in one location to look at on a regular basis. Thanks.
Great, thank you, Ms. Kennedy. So a few points. First is, I was just notified we do have a representative from HRAC here, so if anyone has questions or wants to get feedback from HRAC. Second is, so there will be, I think the next immediate topic we're taking after this, or maybe two down the line, is a discussion on the 2022 goals and priorities. And so I think you will see your specific idea included in there. And then third is, I believe we have the interim executive director from the Anchorage Coalition to End Homelessness who would like to respond. I just want to make a ruling that is Ms. Zalatel, and she is here in her capacity as that interim executive director, not as an assembly member, and I feel that that is appropriate. Go ahead, Ms. Zalatel.
Thank you, Mr. Chair. Through the chair to Ms. Kennedy, we can absolutely do that. And in fact, working to implement the planks of the facilitated process, we probably have more visibility on the various funding streams, both available and in play, than we probably have ever had. So we can absolutely start to figure out a way to produce a document, I would say a spreadsheet, but I know that's not always as digestible to the public, so that we can not only understand what funds are available, but what those funds can fund, because there are some significant differences between how much funding is available for emergency shelter versus housing and other interventions. But absolutely, able to do that, and we can start to pull that into our monthly update.
Great, thank you. Thank you, Mr. Chair.
Great. Thank you, Ms. Kennedy. Thank you, Ms. Zalatel. Mr. Dunbar?
Thank you, Mr. Chair. And I'm trying to think who the right person to ask about this would be. And perhaps Ms. Zalatel has a sense. You know, I share Mr. Taylor's optimism and desire to build more ADUs. On the other hand, I mean, we know how expensive ADUs can be. And I think that, you know, for a lot of folks that are, you know, kind of at the lower end of the income spectrum that are either experiencing homelessness or kind of are right on the edge, we expect that they usually will be living in multifamily housing of some kind. On the other hand, you know, it seems just incredibly difficult to build multifamily housing and to make it pencil. And so that's why we've been exploring, and a number of people have been exploring, you know, purchasing of hotels or former hotels. And I guess my question is, you know, we have heard from the visitor industry that, you know, business is picking up. That was what our discussion with Visit Anchorage was, that the hotels are actually looking to have a pretty good summer this summer and hopefully going forward. So how many of these sort of underutilized properties do we think there actually are around town? And, you know, it's been a little bit frustrating, I think, for all of us. We've gone down the road. We went down the road on a property in Spinard, and then it turns out it was, you know, damaged in some way and it couldn't be purchased. And then, you know, with the Barrett Inn, it was sort of a similar situation. And so I guess my two questions are, one, you know, does anyone have a sense of how many of those kind of underutilized multifamily or hotel properties there are around town? And then second, should our strategy be in some cases to purchase them or work with the nonprofit community to purchase them, or in other cases, just renovate them essentially and leave them in private hands? Because we know that a lot of these properties are essentially serving as low income housing right now. And for people that are right on the edge of homelessness, you know, I think they're, you know, the Black Angus Inn always kind of, you know, sort of notorious, but it springs to my mind. People are spending time there and people are living there. And obviously it's not a municipal property. And I wouldn't advocate that it should be. So I guess those are my two questions. One, do we know how many of these kind of properties there are around town? And two, when does it make sense for us or nonprofits to take them over versus trying to find a way to renovate them so that they're more habitable or but still in private hands? I think it's habitable, maybe.
Thanks. So it looks like Mr. Dole would like to respond.
Good morning, Bob Dole, Senior Fellow with the Rasmussen Foundation. As part of the facilitated process, and frankly before that when I was with the municipality, we were constantly looking for those underutilized properties. And there is not, as you probably have figured out by now, a huge supply of those to pick from. Once you find a property at that point, you have to do your due diligence, which is your building analysis, your environmental piece and all. I believe that there are no opportunities out there that are not already being investigated. And as we learn about them, various parts of the homeless prevention response system, either the philanthropy or sometimes the muni side, are investigating those. We agree that there are opportunities to be had with those, as the sockeye has recently proved, as we continue to investigate other properties. But each one of them is a unique property requiring careful research for what we're doing. And I'm addressing the nonprofit side of a joint funding or philanthropy funding going forward. There may be those other projects where it just needs improvements, and there are reinvestment tools available with tax credits for an owner choosing to go that route as well from the federal side.
So can I ask a follow-up to that, Mr. Chair?
Go ahead.
So Bob, you said the tax credits for that redevelopment is on the federal side. Is there anything we could do at the muni, or are we sort of constrained? I know we're constrained by state law, but yeah, is there anything we can do that we aren't already doing?
Through the chair, Assemblymember Dunbar, we all know what, money is what it really comes down to. I think, and this is just free associating as we're talking, we could examine what could be done to make sure our property owners are more aware in the municipality of different funding streams that may be out there, perhaps working with AHFC to do a presentation through this committee or another means available to them. But that's just free associating as I'm sitting here. But I think probably just sharing that knowledge that there are other routes other than 101 funds or grants out there would probably be good.
Okay, thank you. Thank you, Mr. Chair.
Thank you, Mr. Dunbar. Thank you, Mr. Dole. Ms. Zalatel, did you want to add anything?
Really briefly, Mr. Chair. So in terms of ownership, this is where we've learned some lessons through the facilitation, and it's really hard to find an entity wanting to own these properties because they're not moneymakers. If we're looking at housing folks who are extremely low income, 30% average median income and lower, which is really where a significant amount of the need is and where we often see hotels informally use this housing. There are mechanisms, though, that we can hopefully stand up, like a community land trust. We're all familiar with the Anchorage Community Land Trust for Economic Development. So imagine a similar structure to hold properties for extremely low income housing opportunities. So we continue to explore some of these tools that are used in other jurisdictions that can hopefully get to that ownership question and possibly the ability to not only purchase but rehabilitate existing properties. I'm sure you've all seen, fourplexes or eightplexes that are currently abandoned or boarded up. The question is, how do we rehabilitate existing housing stock to get it back on the market? Thank you.
Thank you, Ms. Zalatel. All right, just to recap what I've heard so far in terms of focus areas, not sort of specific things, but focus areas in a broader perspective. I've heard definitely some interest in policy discussions surrounding housing, interest in funding discussions surrounding housing, and how the two of those are tied. And then I just heard some from one of our subject matter experts discussions around sort of building the community infrastructure, the housing trust, the community land trust. So those are a few focus areas that I have heard. Is there any other discussion on this topic from the members? I guess one thing I will do is just point to our subject matter experts who are in the room. Are there any sort of data points or plans or other things that you think could help illuminate any of our discussions as we consider how we want to move forward in our housing work in this committee? There we go. Mr. Lehman, go ahead.
Thank you, Mr. Chair. We have a lot of different data points in this community, and I think sometimes what we lack is the practical experience trying to work through these problems and that experience of coming up against barriers and understanding where they need to be resolved. I raised that issue because a number of years ago, one of the things that we at Cook Inlet Housing Authority observed was that the private market was having a hard time figuring out how to make infill development. You're talking about small multifamily development of anywhere between 3-4 units on relatively small infill lots, financially viable. And so we decided to take a crack at it and see, after acquiring multiple sites and trying a number of different development strategies, to see if there was a way that development was feasible. And we learned a great deal during that process. And bluntly, we learned exactly why the private sector wasn't doing that work. Once you hit those multifamily design standards, 3 or more units, that development becomes very complex from a planning and implementation perspective. One of our experiences that was illuminating was working through different disciplines within the municipality. I think you've got a lot of really smart folks who do their work really well, But often our experience was that those efforts between disciplines, traffic, fire, et cetera, was not terribly coordinated. And so, ways to resolve a barrier identified by one discipline might cause problems for another discipline. And so we saw that there were some opportunities for enhanced kind of coordination within the municipality that would be cross-disciplinary and potentially get some of these projects across the finish line. That's been framed in some ways as a project advocate. I will say that we've seen the administration and hat off to Mr. Trump in particular, take some steps to make some improvements incrementally with respect to multifamily development. So I want to make sure we point that out. I think the other thing to recognize is that as a community, we find ourselves very frequently talking about these issues in the short term and trying to find immediate solutions, which we should. But some of our best solutions are going to require long-term thinking as well. And so there are some ideas that are tested in other communities and some are untested that we really begin exploring long-term. And it's, ideas that are kind of groundbreaking. Is there a way to offer, developers of new hotels some sort of a tax incentive or a tax credit in exchange for a conversion of that facility to affordable housing when it gets closer to the end of its useful life? These are things for which there's no real incentive today. And because we're so focused on solving these short-term problems, we don't always identify and vet these longer-term solutions. So I would simply park that as an example of an idea that merits some additional exploration down the road.
Great. Thank you, Mr. Lehman. All right, I'm just going to go ahead and just pause for a second, see if any other members wanted to get in the queue or if any other of our subject matter experts wanted to chime in. All right, not hearing anyone else. Then, I think what I'm going to do here is I'm going to take these ideas and I will likely present at next month's Housing and Homelessness Committee sort of my interpretation of those ideas and how we can hopefully work on housing as it relates to the homelessness response system in this committee in a strategic way. So looking forward to engaging with our subject matter experts, our community partners, and this committee in that work for the foreseeable future. So thanks everyone for coming today for this discussion. Okay, so I'm going to go ahead and move us on in our agenda. We have the update on the facilitated collaborative process between the administration and the legislative drafting group, i.e. a couple of assembly members. So since Mr. Weddleton, you did the update on Monday, I will go ahead and do the update today if you're okay with that. So what I'm going to do is I am going to, for folks who are on Teams, I'm going to share my screen so you can see the implementation status update from March 12th, 2022. This will be a repeat for some folks. If you are on the phone, and apologies for not mentioning this sooner, but all of the materials that have been presented today, there's been some verbal reports, so not any type of presentation. But any presentations or slides from today are on the Assembly's website. If you go to committees, the Assembly's Housing and Homelessness Committee, you will find all of the presentation materials from today. All right, so I'm going to go ahead and share and hope that this works. All right, well, that's interesting. Can everyone see that?
Yes.
Be part of it.
Yeah. Obviously, I have to scroll down. Okay, great. So this is the update that came from March, that came out on March 12th. And for folks who aren't familiar, these are iterative updates, meaning that it's sort of the standard update, and then when things are changed, they're changed in this, and they're highlighted in bold. So that's how you can see what the changes are. So I'm just going to go through this highlight section, which I think, as it's named, provides a good highlight of what has been going on in the facilitated process. So first is the Sockeye Inn, which is going to be our complex care facility. Folks may remember it previously being named the Medical Convalescence Facility. So the purchase is on track to close by the end of the month, and Catholic Social Services has graciously agreed to operate. And as folks may remember from last night, we did approve some operational funds through the alcohol tax to assist putting to as part of the funding stack to make sure that this facility can be operational and sustainably funded. Their goal is to open this facility on June 1. Although I think they're going to be doing some things in the interim, but having it for sure open on June 1. Then second is permanent supportive housing, workforce housing. So the Barrett Inn, which has been discussed previously as that facility is on hold. There's just some possible issues with that as the administration goes through the due diligence process, which could possibly make this more expensive. So thankfully, earlier, before I was part of the facilitated process, there was a lengthy look at a variety of different buildings that could be used for some of these different facilities. So an alternative site has been identified, and they're going through the due diligence process there to see if maybe that site might work better than the Barrett, but hopefully we will get some news on that in short order. On the Navigation Center, a contract has been negotiated with regard to design construction for the Tudor Elmore Navigation Center. And we had a work session on Monday for folks who are interested, where we walked through basically how the facilitated process, the facilitated group got to that decision point, and we're able to bring forward that $800,000 appropriation request, which was approved yesterday at the assembly meeting, to move forward with the design for the Tudor Elmore Navigation Center. As folks may remember, in prior discussions months ago, there was the idea of doing it on the old, not the old, but the impound evidence lot located off of MLK Drive. The administration has moved beyond that concept, and now they're using a lot that's adjacent to that. Sort of, it's in between the old APD headquarters and in between the impound evidence lot. There's that paved lot that's there that the administration has identified in the facilitated group has reviewed to use for this facility. The fourth plank is the special population shelter. There has been no location identified yet. Folks may remember that is special population shelter, populations like women, elders, LGBTQ. So special subpopulations of our entire community that may not perfectly fit in a single adult's shelter. We have put in a appropriation request of $5 million to the legislature in hopes that they will be able to allocate that in their budget process as they negotiate and approve the capital budget. And I think that'll hopefully be a shot in the arm for us to move forward with this plank, but right now it is stalled. And then last is the substance misuse treatment. So that is the Salvation Army Treatment Facility off of 48th Avenue. There are 68 beds there. The Salvation Army is trying to get those beds online. They were turned offline after the 2018 earthquake, and they've gone through all the permitting requirements to get that online, but now there's funding that's stuck in the Department of Health and Social Services, or Human Services, whatever the state department is called, and it's been that funding has been appropriated, it's been approved, but it's just stuck. So hopefully that will get unstuck, and we can get those 68 beds turned online. I think that's the main highlights that I wanted to bring up. I guess I'll turn to you, Mr. Weddleton. Is there anything else that we should bring up in this committee?
Mr. Chairman, I'm in the queue here. Can I get a question?
Sure, and then I'll turn to you, Mr. Weddleton.
Sure.
Thank you, Mr. Chair. So I would like some more. I was wondering if I could ask a question about the Salvation Army treatment. A couple of questions. First, is it purely state funding, or are we also involved in the funding? And if it is purely state, then I'm sort of curious why it's, we're considering it part of our solution, but if we're not playing a role, I suppose it's still a very positive thing, of course. But so my first question is, what role are we playing in that? And then my second question is, we had some very specific kind of treatment that was going to be stood up at the Golden Lion. If we remember back to there, I believe it was co-occurring people with mental health, substance abuse, and I believe traumatic brain injury. There was a specific kind of gap in treatment that we were trying to address with that facility. And I'm curious, is that what the Salvation Army treatment is? And if not, what kind of treatment is it? Treatment is a very broad term. So what kind of treatment are we talking about?
Want me to address that, Felix?
Yeah, go ahead, Mr. Weddleton.
Sure, yeah, thanks.
And actually, sorry, before you start, I just want to note for the record, we've been joined by Miss Allard. Go ahead, John.
Okay, good. So we had the Salvation Army off of 48th as one of our components from very early on. And as we got more involved with it and worked with Salvation Army more, and you saw that we had actually funded design on it to figure out what we need to do, with the idea that we would be pitching in some amount of money. We thought $1 to $2 million to rebuild it. But as we started working with them and doing it, we found that they actually have significantly more money that the state is committed to them for, not just that location, but for other things that they are likely to do. So if someone else can pay, that's a good way to get something done. So it's still one of our components. So 68 people we're counting towards, the 400 or so we were, looking to place, when we shut down the Sullivan Arena. We, on the Golden Lion issue or whatever, so I think more broadly, the MLMP $15 million, that has not been a component, though, what we've been looking at, we all acknowledge, is just part of this much broader system, that includes the traditional shelters and other operations. So that would be part of that too. But we do have that on the agenda for our discussion in this afternoon's meeting, just kind of say, how do we want to fit this in? Thanks.
And can I get a little, whether it's from you, John, or someone else, can get again an explanation of what kind of treatment this is? And I guess you won't know until after this afternoon, but the MLMP, the kind of treatment that was going to be provided at Golden Lion, is that still a gap that we need to fill?
That's a huge gap in my view. And Golden Lion wouldn't fill the gap, but would make a huge progress. The Salvation Army had traditionally been 68 kind of long-term recovery for women. And I think at this point we're looking at, it may be for women, we're not sure, it may also be men.
Okay. And I mean, I assume someone has done the calculation, let's say it is just for women. Are there 68 women in the Sullivan Arena that need this particular kind of treatment? Or is it some smaller number? Looks like.
I don't really remember. It might be a smaller number, but there's certainly more than 68 women who could use the facility. And we heard earlier, thousands of people are flowing through the system. Sure. So if there's not 68 there right now, they're flowing through, we can grab some of those people and kind of get them on a road to recovery.
I think Ms. Zalatel was in the queue.
Yeah, Ms. Zalatel, did you want to add, or did John cover it?
Thank you, Mr. Chair. Mr. Weddleton primarily covered it, but I can tell you there are easily 68 women within the mass care of the homeless prevention and response system that need access to treatment.
Yeah, I guess I don't question that at all. I guess I question sort of the again, like I think we're using the term treatment. It's a really broad category, and so I just kind of want to make sure that we are all on the same page. It's this kind of treatment that will help get people out of the Sullivan. Thank you, Mr. Chair.
Great, thank you. And I guess just to add my own comment onto that, folks may remember before I joined the facilitated process that I raised concerns about treatment in specific and how we were dealing with that. Obviously, like Mr. Whittleton alluded to, it's a much broader issue, but definitely looking forward to digging into this more. Thank you for that question, Mr. Dunbar. Okay, I think that's actually, sorry, turning it back to you, Mr. Whittleton. Was there anything else on our update that you thought we should add?
No, you did a good job. Thanks.
All right, thanks. So let's see. Okay. All right, so then just going back to my agenda, I think the next thing we have before us is the 2022 committee goals and priorities. So I'm going to go ahead and share my screen again. Not you. There you go. And all right, so this is, I think folks should have seen this emailed out maybe last week. This is my take on the 2022 goals and priorities. I'm going to start when I review this, and then folks can get in the queue if you have thoughts or questions. I'm going to start on page 2 because I think that's simpler. So the annual tasks, as I was going through and thinking about this, here's sort of what I've considered, and also based off of feedback that we got at the last committee meeting, or I think it was 2 committee meetings ago at this point. So meeting with legislators about the legislative program and requests that we have as a specific to homelessness was something that a committee member wanted to add to our annual tasks. A review of the point in time count data. I had thought maybe we would fit that in today, but it does look like that data isn't 100% ready for prime time. So likely April will be the regular month that we review that data in committee. A late winter process for debriefing the winter plan for improvements. So I consider that to be May. And then the early summer planning for the upcoming winter's plan. So July, to really start digging into the winter that is soon to be coming. What is our plan? What do we need to do to get ready? Then a review of the Anchored Home Community Plan, doing an annual review in August, and then beginning to prepare items and thinking about the legislative program as it relates to housing and homelessness. So those are the annual tasks. You will see here potential future projects. I don't really have anything yet, but I will update that as those ideas are brought forward. Okay, so moving on to page 1. So I ranked the various ideas that came up and also put names associated with them. These are, just being totally blunt, these are, as the chair, so the areas that I would really like this committee to focus on. I'm happy to take feedback. So the ranks are 1, focus on housing, 2, focus on the oversight of the facilitated process, 3, what do we do after federal funds end? 4, communications for homelessness to the community. 5, shelter licensing, how is it being implemented? Are shelters going into B3 zoned areas? Whoops, I have 2 5s in here. 6, better track funds out of the general funds, grants for homelessness, get a sense of what the MOA is doing. And then 7, what is our role in solving and addressing homelessness? So in terms of, you can see, I'm not going to read everything to you, but you can see my initial take on what next steps might be for each of these 7 priority areas and when they would fit in the timeline between now and the end of the year. So I guess I'll just pause there, see if folks have any thoughts, addition, changes. Otherwise, this is going to be something that's a living document. I will update it monthly, and we can just sort of walk through this briefly month to month so that we can get an update on what's going on. So I'll just pause, see if anyone wants to get in the queue. All right, so not hearing anyone, I will go ahead then mark this. I'll take off the draft. But again, this is going to be something that we will bring up month to month. And so there's always going to be an opportunity for folks to discuss this and make changes and alterations. And much appreciated, everyone, for putting in your thoughts. So with that, I'm going to stop sharing, and I believe that completes our business items and our committee legislative and budget priorities. I guess I will open it up to see if anyone has legislative priorities or 2022 budget items that they would like to discuss at this time. All right, not seeing anyone, then I'll go ahead and move on to final audience participation. So if folks would like to participate, please unmute yourself. If you're on the phone, it's *6 to unmute yourself. You'll have 3 minutes. And if you could please state your name for the record.
Roger Branson.
Yes, go ahead, Mr. Branson. I have started your time.
Thank you. I just want to express my gratitude to the members of the committee and the assembly who are just paying attention to the details and the fine data points and keeping track of the folks I advocate for. I agree with Assemblyman Weddleton that we are either at or nearing a watershed moment for the homeless, and I'm really impressed with the meeting today, the attention to detail, and the commitment to continue the path we've set over the past 3 years now. And I just want to express my gratitude. So thanks to all.
Thank you, Mr. Branson. Are there any other members of the public who would like to participate?
Yes, this is Reverend Michael Burke. I'm here on behalf of the Campbell Park Community Council. I want to thank you all for the work that you do each and every day for our community. I also want to renew my request for any assistance that you can provide us with coming up with a written copy of the camp abatement process. Especially through spring and summer, we get many different calls from businesses and individuals within the neighborhood about the process of posting camps and when that abatement takes place. Usually that engenders a lot of anger at the municipality, the assembly, the Park Department of Parks and Rec. And I think we can be in a position to help mitigate some of that and to help explain the process to the members of our own community council area and help them realize what are realistic expectations. But to do so, we really need a copy of the plan. And we've been unsuccessful despite repeated attempts in getting a copy. So any assistance that you could provide in that area would be really helpful.
Thank you. I know I did bring it up at a prior committee meeting, and I didn't hear back from the administration, so I will ping them on this issue, and hopefully we can get something to you and to the community councils. Okay, are there any other members of the public who would like to participate?
Is this where Danny Parrish can speak up?
Yes, this is where you can speak up. So if you can go ahead and state your name, you'll have 3 minutes.
Okay, thank you. My name is Danny Parrish, spelled with 1 R, P-A-R-I-S-H. I live on 16th Avenue directly in front of the Sullivan Arena, so I get to experience 500 people that are homeless daily, 24 hours a day. Over the past 2 years, I have received nothing short of 20 different phone numbers for people that were supposedly over the Sullivan Arena. Up until just recently, Hannah, who is the new 99+1 general manager, or assistant general manager. But I live there, and I am looking to retire. I bought my house there in 1994 with the intent of paying it off, retiring, and living there happily ever after, because it's a beautiful little community. Used to be, with all the sports complexes, the bike paths, close to downtown, 1 block from a bus. I was hoping that I would be able to, retire and live there until I die. But right now, what's going on, I know you guys have said June this year, but we said that June and July of last year, and we said that June and July of 20. But I'm uncertain that what everybody's saying is actually going to come to fruit. I just have a hard time accepting that. And all the previous managers, Bob Dole was one of the guys that I've talked to over the time. Kathleen, Daniel, Hannah, Lauren, Moses, Bobby, and the ombudsman people, of course. So I've had lots of conversation with people, and everybody's always said, we're getting them gone. I just would like to know that at some point the city will just purchase my home from me, so that I can just move on. Nobody's going to purchase it to live there in their right mind, just because of what is going on over there. I pick up beer bottles every day, whiskey bottles every day, toilet paper on my sidewalk every day. And in the beginning, I was putting it in my trash can, trying to be a good neighbor. Now I'm so angry. And I have been in social services for 42 years, working at this organization where I'm sitting at my desk today, 32 years at this organization. I feel like I'm going to go to hell when I die because I've lost my compassion for that population of people. I'm throwing all the garbage over in the Sullivan Arena's parking lot. People that are homeless are out there standing around watching me and then asking me, why am I throwing my trash? Okay, thank you.
Yeah, thank you.
Somebody please help me, okay? Y'all are all there. Y'all can do it. Thank you, Felix. I apologize.
You are good. Totally understood. Are there any other members of the public? Thank you. Are there any other members of the public who would like to participate? Again, if you're on the phone, it's *6 to unmute yourself. You'll have 3 minutes. All right, not hearing anyone else. Thank you to all the members of the public who participated today and to continue to lend your voice to this issue. Next is committee discussion. Is there any other final discussion from the committee? All right, not hearing anything, then I will go ahead and adjourn this meeting. Thanks everyone for your time today.
Thanks.